All right, many thanks to Ibrahim and Hamidou for the background report. We have guests that have joined us so far, and we're expecting others to join us in the course of our conversation. Let me begin the introduction with Professor Bala Mohammed Audu, who is the President of the Nigerian Medical Association, NMA, and he's also the Vice Chancellor, Federal University of Health Sciences, Azari in Bauchi State. Professor Audu, thank you very much, and compliment of the season to you.
Thank you for having me.
All right, also join us for the conversation all the way from Yenagoa, Bayelsa State, is Professor Sefa Brisibe, Commissioner for Health, Bayelsa State. He is the co-chairman of the National Emergency Medical Treatment Committee for the National Emergency Medical Services and Ambulance System in Nigeria. Many thanks for joining us, Prof.
Oh, thank you. Thank you for having me.
All right, gentlemen, again, compliment of the season to you also, Professor Sefa Brisbane. It's good to see you. But let's start our conversation with the NMA president, who is, of course, joining us from Bauchi State. Who's joining us from Maiduguri studio. I'd like to start with, a review of how we fared in 2024, beginning, of course, with the implementation of the National Health Act. How far have we done, considering that, again, Nigeria is a member of the Organization of Economic, Cooperation and Development, which, have a benchmark in terms of percentage, budgeting percentage. How have we done in implementing that act?
Thank you very much for that question. I think 2024, we fared very well in the health sector in this country, barring the challenges we face with the healthcare workforce. The National Health Act implementation has various components, as you very well know. Amongst them is ensuring universal healthcare coverage. In other words, access to quality health care with minimum financial hardship to Nigerians. We have seen the 2024 budget implemented. It constituted about 4.6% of the 2024 budget, which of course falls short of the 15% of the Abuja declaration. But a component of it is the significant amount put into the Basic Healthcare Provision Fund, which seeks to ensure that particularly our primary healthcare facilities are up to standard in terms of the provision of quality healthcare to Nigerians, in terms of ensuring that the health infrastructure is adequate at that level of care, so that Nigerians, particularly vulnerable population of Nigerians, are able to access affordable health care at that level. And we know from that level there are effective referral systems. We have also seen the presidential initiative for unlocking the value chain in health being implemented in 2024, with a very significant move towards creating the health infrastructure, the health ecosystem for production of locally produced medications that will help alleviate the cost of medication in this country while providing good quality medications that are effective. It also takes care of other value chains along the line, including the health manpower capacity development in terms of training. And we also saw in 2024 the enactment of the National Health Policy on retention of health workforce. This is aimed at ensuring that the good quality health workforce that Nigeria produces, that the rest of the world is competing with Nigeria in coming to this country to actually recruit the health workforce that was trained in this country because of their quality, to go and service the health care delivery in many developed countries of the world, including the United States, the United Kingdom, in Europe and in the Gulf states. We've seen efforts to try to retain that workforce in Nigeria so that it continues to provide the quality healthcare delivery that we also desired. We also saw in 2024 the joint annual review of the health sector performance, and it did show a significant improvement, particularly in vital health indices, particularly maternal and child health care. And we saw the declaration to improve our maternal and child health indices by providing free cesarean section for vulnerable populations. We are aware that many institutions have started implementing this. We need to evaluate down the line the impact that this would produce in reducing maternal and perinatal mortality in Nigeria and its sustainability as funds are being made available to these healthcare facilities to be able to be refunded for whatever free cesarean sections they were able to perform. We've also seen the upgrade of a number of healthcare facilities, at least one per geopolitical zone, to provide cancer care, standardized multidisciplinary cancer care that would enable us.
All right. Many thanks, Professor Audu. So much, happened in 2024, but would not let you say everything in one breath. I mean, the conversation continues. So we'll come back to you, and of course, you'll continue from where you stopped. So we need to also hear from Professor Brisibe, and also we have joining us now for the conversation Dr. Salma Ibrahim Anas, Special Advisor to the President on Health. Many thanks for joining us, Doctor.
Thank you so much, and good morning, Nigerians.
All right, so I think I would go to Bayelsa first before we get to Dr. Anas to tell us, all that, 2024, brought about in the health sector. Professor Brisibe, I want you to speak about your state. Did you make any progress in the health sector in 2024?
Thank you very much, Professor Bala and Claire, and to everybody in the studio. At the subnational level, I would speak more about the subnational level, and what I could say is that we had a very clear focus, which was led by the Federal Ministry of Health under the able leadership of Professor Ali Pate. Because it was so focused that there were programs that trickled and encouraged partnership between the state and the federal level. So there was this strengthening of governance and leadership, mobilization of funds, to invest in very relevant areas, just like what Bala said, in terms of value chains, in terms of infrastructure and innovations and technology. Because of this very strong leadership and governance platform provided by the federal ministry. At the subnational level, there was serious progress. There was tremendous progress. And for the first time, we had the JAR and the Joint Annual Review, where all states, the data from all states were presented, reviewed, and see the progress we've made. For Bayelsa State, we made tremendous progress in the area of immunization. We reduced the number of zero cases significantly. Our maternal infant mortality I also experienced slight progress, and we also embrace very germane policies from national, which has to do with preparing our primary healthcare centers to see that we also get into what the national also said is a primary healthcare challenge. And we also did very well in that, although not as expected. We also, our disease, public health emergencies control system, preparedness was also something that we could boast of in Bayelsa State. We had series of outbreaks, but with the strong governance and then the building resilient systems in the public health emergency response system, where our target was that, well, we prevent it. If we can't prevent it, of course, we try and mitigate man-to-man transmission, and if at all that does not happen and people get infected, we must not lose lives. So with that type of strong framework, we were able to tackle our public health emergencies very, very well without any mortality, be it mpox, cholera, yellow fever that we had last year. And of course, we also build very strong partnership and collaboration efforts with federal and our international partners and communities to see that whatever we are doing is driven, not just driven deep into our communities and rural areas, and to see that everybody appreciates and utilize our primary healthcare facilities. So that is the type of thing that has happened in Bayelsa. So we hope that this year is going to be better.
All right, Professor Seifa Brisbane, thank you for your opening, remarks and for corroborating Professor Aldu's, statements also on the state of the health sector in 2024. Let's bring the conversation to the studio here, and Dr. Salma Ibrahim Anas, who is the essay to the President on Health, will speak further on the probably if there are significant milestones. We've talked about the implementation of the National Health Act, in 2024, and both professors have spoken glowingly about that. I'm wondering if we had, maybe private, practitioners here, they will, also speak in the same vein. But let's look at the components of the Act, the universal health care, which of course should be driven, by robust health infrastructure, skilled personnel, and so on and so forth. Were there outstanding milestones recorded in these areas in terms of, driving universal health care?
Thank you so much, and good morning, Nigerians. And I want to say Happy New Year to everyone.
Same to you, man.
And our prayers to Almighty Allah, it will be a better year and a year of consolidation, a year that we will begin to see the outcomes, the results of the promises made during the campaign by His Excellency President Bola Ahmed Tinubu. I was opportune to work with him pre-election to refine the promises, and I have seen the passion in him and the commitment in him to the health sector development in Nigeria. So I led the Presidential Advisory Committee on Health, where we drafted the policy document that His Excellency endorsed around 8 priority areas. But with the main focus, the main vision of President Bola Ahmed Tinubu is to see that we deliver quality healthcare services to all Nigerians, irrespective of where they are, irrespective of gender, irrespective of social determinants of the people. And this is what he has remained committed to it till today, after 1.5 years, around the 8 priority areas. And as you have said, I'm very glad that the 2 professors at the subnational levels have alluded to a lot of progress that have been made in the last 1.5 years. So if you take each of the 8 component areas, the first is about the leadership and governance, and we have seen the team that have been assembled by His Excellency under the leadership of the Honorable Minister of Health, the coordinating Minister of Health. For the first time in Nigeria, we have Minister of Health called coordinating minister, and it's deliberate and intentional by His Excellency to ensure that health sector does not stand as a standalone, but it is all encompassing because it has several other factors that drives health that are outside the health sector. So the Minister of Health coordinates the overall sector, not only at the national, but also subnational level, connecting with other sectors of development, like water resources, security, and all that, agriculture, education, women affairs, and several others. So I think this has clearly been demonstrated that we are working towards that, and it's a good success story. So in terms of looking at some of the commitments, I think they have all said a lot in terms of that. One key area out of the 8 pillars were around local manufacture. And the first thing when the minister came was to recommend to His Excellency to approve presidential, a national coordinator and a structure that looks at the value chain, unlocking the healthcare value chain in Nigeria. And a lot of tremendous progress have been made towards that. We've seen all the engagement, we've seen the attraction back to the country of potential investors in Nigeria, manufacturers of drugs and medical equipment. And we've reached several other advances. And we are going to see a lot of changes in 2025 in terms of realization and implementation of those commitments. Then another area that you have seen, which is key related to how do we achieve universal healthcare coverage, is the strengthening, which Prof has already mentioned, of the primary healthcare. Because the primary healthcare facilities forms the platform for delivery of healthcare for Nigeria, especially when you talk about vulnerable Nigerians, which constitute a significant proportion of Nigerians, over 70%. So there has been an expansion of the primary healthcare to 2 PHC per site per ward, 2 functional primary healthcare per ward in all our constituents in Nigeria, and also expansion of the universal healthcare insurance coverage. This has all increased to ensure that we have increased access to healthcare services. And we've also seen the budget, which they've also mentioned about, because without funding, it is not possible. And this is in addition to several other funding mechanisms that have been established in the last 1.5 years, not only in government, but also at the subnational level, development partners, and harnessing all those resources to maximize effect, what was His Excellency positioned himself to do, and the Minister of Health is matching that, where he is now coordinating the overall national health sector investment, under one platform, and using the mechanisms of what we call the sector approach, the swap processes, and this is led by himself, the Minister of Health. So it is aimed to bring all resources together, so that we harmonize and maximize the effect of our resources. So we have one national plan, one implementation plan, one delivery plan, and then the conversation is the same. And this addresses our priorities in the country. So it's not like where we have fragmentation in the past, and then whoever comes with resources just go in and do whatever they want to do. So all these have been addressed in the country, and I think these are very remarkable efforts that have been put together.
Absolutely. The impact of governance and leadership in the healthcare sector is quite visible. I wanted you to give us figures, if any, in 2024, because you talked about 2 primary healthcare centers in each ward. In 2024, what is the value addition in terms of functional and well-equipped primary healthcare centers?
So in 2024, over 16,000 primary healthcare facilities are functional. And when we talk about functionality, delivering quality healthcare services, over how 40,000 healthcare providers, frontline workers only, have been trained, in addition to several other frontline health workers that have been trained to improve their quality, of service delivery.
Are these new intakes?
These are new plus those that are already existing, because that have not had training in several years and are not delivering quality services. So we expect to see improvement in our quality of services, because a lot of surveys have shown in the past that Nigerians have recorded very poor quality service delivery, especially at the primary healthcare level. So that was why we focused on capacity development, capacity building of the frontline health workers, because these are healthcare providers at the first point of contact within the primary healthcare. So these are numbers that we can see clearly in terms of improvement, and then the uptake of services. And of course, it's too early to talk about the statistics, but the National Health Demographic Health Survey, which was released, the result, which took place in the last 5.5 years, covered the last 5.5 years, has indicated some modest improvement, especially in the area of maternal and child health improvement.
But it's still high. It's still high. It's almost, yeah, it's per 100,000. We're hitting up to 1,000.
Well, it's still high. The NDHS of the last one, 2018, yeah, it was about 512 per 100,000 live births. So work is still in progress to come out with the latest statistics, but it's too early to get the results. But I strongly believe in the next few years, we don't have to wait for another 5 years. In the next 2 years, we should be able to see remarkable improvement because of all the interventions and then the new strategic and innovations that have been deployed and adopted. So, but if you look at other areas like contraceptive, uptake of family planning, which is also a huge game changer towards improvement of maternal health, there has also been some slight improvement in that area, especially in states that have recorded less than 1% in the past. Today, we are seeing remarkable improvement of about 5%, 8% improvement in family planning. So we are not saying that it's a success story yet. There are lots of work to be done, but the progress that has been made in terms of laying a solid foundation, towards delivery of quality healthcare has taken place in the last 1.5 years. So what we expect to see in 2025 is to see implementation, realization of the aspirations of President Bola Ahmed Tinubu, because has created a lot of opportunities and then created a lot of enabling environment. Because if you also take the area of local manufacture, one of the areas that the president did was to areas that are bottlenecks, to realization of the potentials of improvement of local production of medicines, pharmaceuticals, and diagnostics, and some equipment, is the importation tariff. And he has passed an executive order that banned, eliminated that bottleneck of value-added tax and also additional tax for importation.
All right, many thanks, Dr. Anas, but I'd like to stay with you because of, the point that you made that, this administration is committed to delivering quality healthcare to all Nigerians. We know that if you want all Nigerians to access quality healthcare, you must talk about the costs. And when you talk about costs, you want to talk about the Health Insurance Act. Speak to us about how the National Health Insurance Authority Act, impacted on access and affordability of healthcare to Nigerians in 2024.
So this is a very critical area also of commitment of President Bola Ahmed Tinubu, because one area he said he's going to reach about 50 million Nigerians that will have access to affordable, almost free quality healthcare services to Nigeria. And the first thing he did was the expansion of the mandatory health insurance scheme, so that people that attend primary healthcare have free access to services, secondary as well as tertiary institutions. But this is within the formal sector, but also outside the formal sector. People are also free to have access to it. So it's still work in progress because of the economic situation. A lot of changes have happened. So the purchasing, what they have proposed before, may not be able to do, but work is ongoing to also improve on that. So with the current allocation and then the current approval of the vulnerable group fund, there is a vulnerable group fund that was also approved by the president, all aim to ensure safety net, and a financial protection for Nigerians, especially vulnerable people, so that they can be able to afford healthcare services and also able to access healthcare services within their reach.
Okay. Maybe we should get to Maiduguri now, let you rest a bit. Professor Audu, President, Nigerian Medical Association, when you spoke earlier, you spoke about, the policies and, what government is doing. But I want you to speak about the medical personnel. Maybe you want to speak about those in the health sector who work in the health sector. What was it like in 2024? Speak to us about the challenges of professionals in the health sector in Nigeria.
Obviously, there have been great challenges for health workers in the last 1 year. 2024 saw a very challenging period with the brain drain process still ongoing, the Japa syndrome, like we have christened it in Nigeria. It has left a dwindling number of doctors and other healthcare professionals to strive and still provide the quality health care that would have been provided by a larger number of Nigerian doctors and healthcare providers. In 2024, only about 58,000 doctors renewed their license, which meant that we had, by WHO standards, just about one doctor per about 600,000 population, as against 1 to 6,000 as recommended by the World Health Organization. This is a worsening situation, as we have seen Nigerian doctors and all the healthcare providers moving out of this country in an external brain drain phenomenon. But we also have an internal brain drain mechanism where doctors and other healthcare providers move away from states and local government employment and other non-federal MDAs that are not MDAs to core federal government health MDAs because of pay disparities. This internal brain drain has also resulted in a worsening performance, in the sense that in rural setting, when we talk about one doctor per 600,000 population in Nigeria, we're talking about the urban setting. WHO has shown that in a rural setting, we actually have only one doctor per about 300,000 population. Now, this means that invariably the performance will be tasking. There will be a lot of stress on those of us who have remained behind to still deliver the kind of quality healthcare that is needed. Any worker who is stressed at the point of service delivery is invariably also subjected to errors, and we have seen situations where doctors and other healthcare providers have actually been so stressed that we have had even cases of work stress-related deaths, in which there has been a situation where I think it's a consultant surgeon in one of the hospitals who, after carrying out a number of surgical procedures, went to rest and was really ended up having sudden death. So these kind of challenges exist, but I think those of us who have remained behind have resolved that we have no option than to make sure we keep doing our best and hope that the national policy on workforce retention would not just help to retain the health workforce that has decided to remain behind, but that the government policy aimed at doubling the carrying capacity for trade.
Professor Aldo, the data you just read out, I mean, is, for want of word, it's mind-blowing, and I had to, you know, scream out loud here. One doctor per 300,000 Nigerians in the remote areas. And I'm wondering how Bayelsa, Professor Ifabrizbe, I'm wondering how you know, Bayelsa is coping, if this is the reality. Bayelsa is a predominantly riverine area. And I remember some few years back, Fangbe community, I mean, you needed to go by canoe or something to access quality health care in the FMC in Yanagoa. That's a few years back. So I'm wondering how, you know, what improvement really in terms of accessing quality health care has come to those communities in the riverine areas especially.
Yeah, thank you, Claire. But the basic truth is that we've made tremendous improvement. And then, of course, His Excellency
problems there.
Yes, I actually, you know, I've loved him to tell us, because this is not acceptable. One doctor to 300,000, you know, Nigerians in the remote areas, and you know, it's quite challenging.
Yeah,
I'm just wondering how they're able to cope.
So it's not easy to cope, because that's why the limited health workers we have are always undergoing one form of psychological trauma or stress. You know, burnout is very common among them. And Professor Audu has tried to put it together. He has just tried to touch. He didn't expose most of the problems that medical doctors and other health workers are facing, you know, at the state level. They are overburdened because of work and stressed. And then we are all working towards improvement of all those conditions.
Yeah, so how, what are we doing to stop the immigration?
To stopping, you cannot stop 100%, but efforts are ongoing to curtail and to reduce it to the minimum level that does not have any impact, you know, public health threat on the health system delivery in Nigeria. So it's both ways. You look at production ways and also the quality of production and also the retainership. Our production is still grossly inadequate. Let me start from there. So what this government is doing...
When you say production, what do you mean?
Production of healthcare providers, generally. Skilled healthcare providers. You look at the medical doctors' production, the nurses' production, and midwives' production, pharmaceuticals, and all across board. So what this government has done is to leverage opportunities within the private sector. We've increased within the formal sector. We've increased, for instance, the colleges of education, nurses and midwifery that train nurses and midwives. We've increased their production. Some used to produce just about 100 per annum. Even LUT, they used to produce less than 100 per annum. Now it has increased beyond that to about 250 and above in most institutions. And we've also attracted private sector investment in the production of healthcare providers. So recently you will observe that a lot of medical institutions are coming up that are owned by private sector, but well regulated by government. Not only medical schools, but also schools of nursing and midwifery across the country.
All right.
So this is another area. And then he has talked about the policy on migration, which was launched last year. It was presented at the FEC and approved and launched at the National Council on Health by the Honorable Minister of Health. So these are also ways that clearly specify how do we improve retention of our healthcare providers in Nigeria, bonding, improving their working environment. Because most of them, what they talk about is about the working environment, low remuneration of healthcare providers. And he has talked about the internal migration. And this is not only responsibility of federal government alone, but also a lot has to be done at the subnational level. Because if you look at our healthcare systems in Nigeria, the tertiary institutions are those that are owned by the federal government. And those are the teaching hospitals, the federal medical centers, the specialized hospitals like the neuropsychiatric hospital, orthopedic hospital, fistula centers and all that. Those are just a handful. They are just limited numbers compared to the overall number of health facilities that we have in the country that are mainly owned by subnational government. The secondary level of care, that is the general hospitals, if I may say, and some specialist hospitals, the primary health care facilities, the comprehensive health care center, all those are owned by subnational levels. And that is the level where we have majority of our healthcare providers. So what am I saying in this sense is that the remuneration has to be equal. There should be equity. If you are working as a medical doctor, for instance, in a secondary healthcare facility, you should be remunerated the same way as a medical doctor at a teaching hospital. Because you are also delivering services. In fact, your workload is much more. It's much more. So we've been doing advocacy because this is one of the commitments of President Bola Ahmed Tinubu to close the gaps between the subnational and the federal and the national level.
All right.
And to ensure that the subnational government also aligns with the aspirations and priorities of the federal government. So a lot of advocacy has been ongoing and some state governments have demonstrated. One state that I can say recently where we had the National Council on Health was Borno State. The governor has addressed those disparity between in terms of remuneration. So all health workers will be paid the same. And we've also seen very good recommendations and efforts coming up from Ebonyi State, the governor, in terms of motivation and remuneration of medical doctors. So those are some of the efforts we need to encourage in the country.
I wanted to ask Henry, when you say health workers should be paid, at par, should be at par depending on their level,
yes.
Is it across board? I mean, remuneration equity across board, including nurses, doctors, and
yes, across board, include all healthcare providers, because the place is not only occupied by medical doctors; it's a teamwork. So nurses and midwives, pharmaceutical, even the technicians, pharmacy technicians, laboratory scientists, psychotherapists, and all that is a team, is a teamwork. So it should be all across board. And some states, let me just mention, have even increased the retirement age as a way to address the issue of the brain drain. Because you find that health workers retire at 60, medical doctors, nurses even retire much earlier, before 60 years. So they've now reabsorbed them and increased their retirement age to 65 years. So those are some of the ways they have used as strategies to retain healthcare workers.
All right. So many thanks, Dr. Anas. I'm sure that if we speak with Professor Aldo, he'll tell us more challenges that those in the health sector face, But away from the remuneration which you have mentioned, I'm sure another critical aspect to be access to facilities and adequate infrastructure, for this personnel to work. But let's get back to Bayelsa. Professor Brisibe, I'm sure your connection is much better. You were about telling us what Bayelsa is doing, considering all the challenges in the health sector.
Yeah, thank you for having me again. The network was a little bit bad. In Bayelsa, under the Assured Agenda, the R stands for Robust Healthcare Delivery. And what is being done to address some of these issues, of course, just like Claire said, Bayelsa is 70 to 80% waterlogged. So what we do is that we try as much as possible under the Assured Agenda, when we are building any health facility, we do not just build a hospital or we do not just build the primary healthcare center. We also had accommodation for critical manpower, human resources for health, for the doctors, for the nurses, in those healthcare facilities. So, and that's enable people to stay back and all that. Again, we also, Bayelsa State is the first and I think the only state that has taken this issue of human resources deficit for health very, very seriously, both in the immediate, long, and medium and long term. So what we do is that we've leveraged on our partnership with partners and federal government and other development partners to see that our primary healthcare facilities, one per ward, is at the second tier compulsorily. And what I mean by second tier is that these primary healthcare facilities have accommodation, have array of staff from SHU to nurses, and also have some level of solar energy providing power, and have facilities that will enhance proper immunization. So we have all that. Not only that, in the long term or in the medium term, Bayelsa State has demonstrated the Residency Training Act. This is a policy signed by President Tinubu to see that a residency program, doctors that are undergoing residency are supported, because it's pretty challenging. So Bayelsa State is one state that has domesticated that as a law. In this, we support our resident doctors with finance to see that their training is better, and that enhances retention, both internal and external retention. So that is what we're doing at the medium point. But in the long run, to solve some of these human resources gaps in human resources for health, Bayelsa State also established the Bayelsa Medical University, which is providing training. And just recently, we also upgraded our School of Nursing to college status. So people assess it through JAM, and also be able to go for NYSC. So all that is being done, and there is massive investment into those type of things. What we are thinking is that, look, because of our difficult terrain, of course, our ambulance system, we have the boat ambulance system to see that we are able to get doctors and health workers, and also mobilize people that are in critical situations for tertiary care out of their those rural areas to assess, just like you talked about Frangbe. Of course, another thing is that within this period, because healthcare is multi-sectoral, the governor has done a lot to also get road infrastructure to these rural areas. So by the day, we are also reducing the percentage of hard-to-reach areas in Bayelsa State. We also had this partnership, ongoing partnership with a logistic management firm, which is called Zipline. So because of our terrain, Zipline will be able to take vaccines, to fly vaccines through drone to very hard to reach locations in Bayelsa within minutes. That has helped our logistics management, and for vaccine immunization, and also for health products like blood, and then maybe getting investigations done. So it's something, it's work in progress, and most especially these things become a little bit easier with the swap approach, because it's one conversation, one reporting, one planning, one budgeting across the subnational levels. So with that, it becomes a little bit better. And of course, the universal healthcare coverage is something that at the subnational levels, all states presently have the universal health insurance schemes, and this has expanded the access, the onboarding of vulnerable groups into these subnational health insurance schemes has expanded that scope beyond imagination. And for Bayelsa State, it's compulsory for both the formal and is mandatory for both the formal and informal sector. So we are doing all that to see that the challenges, our environment that is challenged, will be able to overcome these challenges and get everybody to have access to healthcare equitably and in quality and the quantity they want. I always believe that, look, equity, if I am in Yaba Metropolis and I'm assessing health first by a doctor, I also believe that at the primary care level, people should also have time. So we are deploying youth corps to man our primary healthcare facilities, if not every day, to see that
Professor Brisby, thank you. The network is not friendly. Again, considering the topography of Bayelsa State, so many challenges, especially from, communities that are riverine based. And I don't know if he's back. I wanted to ask you, considering, the recent spread of cholera and the difficulty in accessing, potable water. I know from Opolo, even Ekeki down to Yanagua in those days, it's quite difficult to get clean water. So I'm just wondering how you've been able to cope with your public health, in 2024.
Claire, there is a little bit of change in all that narrative. The prosperity government is investing massively in getting potable water across these areas that you've mentioned. So the situation has improved. However, for us, we take public health emergencies very seriously. And for a ministry and for the state, we prioritize public health, we mainstream public health. And because of that, we try to build a public health emergency response system in a way that, and a strong and resilient healthcare system, in a way that even when we have public health emergency crisis, we able to provide the minimum and recover and restore almost immediately after post. So what we have done is, under the metrics that one, if there is an outbreak, we must do all to prevent it by educating, by engaging local community leaders for personal hygiene, environmental hygiene, and proper practices, food handling practices. If we are unable to prevent at that level, well, the next level is that if it occurs, we must try and prevent man-to-man transmission. And if we are not able to do that, and if it occurs, we must rapidly deploy medical and health commodities and personnel to those areas so that we do not lose lives. This has been the fundamentals of our approach in tackling public health emergencies in Bayelsa, and that has given us results. So for the first time over a long period, we've been able to have zero mortality from all our public health emergencies, including the outbreak of cholera. So it's a system that engages very strong governance and leadership framework. And of course, anytime we have those, luckily, because of the SWAB approach, we have the collaboration and partnership from the national level and WHO and other international partners to see. So they are also going to be able to tell these stories the way I'm telling them. So it's important for us. It's important that we have this strong framework to build strong, resilient healthcare system that will be able to tackle these public health emergencies effectively, timely, and to see that they are prevented. And that is why we have mainstream public health, to see that all the time we are advocating. Of course, immunization is compulsory. For every child that is going to primary and nursery school, you have to present your immunization card. We are not driving people away, but it's to see that if you don't have, we deploy persons to get to that point and get children immunized. All these are strategies to see that we reduce preventable diseases, we reduce the possibility, the vulnerability of children, mothers, and others from having seriously affected by some of these public health emergencies. So in terms of cholera and other emergencies, our platform framework is robust enough to see that we contain and we do not have mortalities from it. Thank you.
Many thanks, Professor Brisibe. I must say that Bayelsa is doing so much, and we hope that other states are replicating some of these initiatives. But let's quickly go on a break now. When we come back, we continue the conversation. Stay with us.
When we think about the digital economy, you can see it as the marketplace for digital goods and services. And increasingly, it's becoming a force to reckon with and an incredible contributor to economic growth, because we've seen the growth in technology and digital platforms. Technology has it really permeated every aspect of life and business, the way we live, the way we work. And when we talk about the digital economy, we're really talking about leveraging technology and digital platforms in a powerful way to drive growth, to drive solutions to problems, to drive applications, and to provide services.
The digital economy is something that has the potential to help Nigeria leapfrog a lot of its development challenges, right? Because think about what the mobile phone did for Nigeria years ago. That is the potential we have for digital, because it has a way of reducing the barriers to innovation. It has a way of being able to transform service delivery, whether it's government's delivery of services or whether it's services in the health system, where people can use digital to actually be able to see their patients better. But it takes a lot to realize that potential of digital. The first thing is, like every other thing, there's an infrastructure you have to build to be able to make sure that digital economy can thrive. Think of something like, capturing that happens in Nigeria, right? Where you capture, people's biometric when they go for a driver's license, when they go for passports, and each of those are separate things. Largely a system where we're able to streamline that and actually have a platform that exchange biometric information that makes it easier for people to access passports, easier for people to register to vote. But today it's very tough, right? But those are basic infrastructure that needs to be invested in. A lot of it is through government and private sector collaborations to make it happen.
If we're looking to accelerate growth in the Nigerian space, we really need to look at enabling the digital economy. That includes providing digital infrastructure, connectivity, because that's the highway, like the highway that everything rides on. We need to think about digital capacity building in terms of the suppliers to the economy and also the consumers within the economy. So a robust digital literacy initiative. The good thing about technology is that, one, it helps you to transcend boundaries. Two, it creates a level playing field, really, because if you create a solution, a technology-based solution that is applicable in this environment, that same technology can be applicable, exported to other environments. And, technology platforms also help drive collaboration, right? When we're thinking about innovation, when we're thinking about business growth, collaboration is an important part of that. So when we think about the impacts with the rest of the world, we find that actually technology platforms are giving us an opportunity to engage more actively, to collaborate, to create partnerships, to even export our knowledge and services for people to engage with all the great things I'm talking about technology and digital platforms. They need access, internet access, broadband access. So we need to make sure that access is more available and affordable for the average user.
The most important thing is to think about where you want to go as a country and actually what type of policies are going to help get you there. There are examples of countries who've been able to transform using digital, for example. There are very clear things those countries did to be able to make it happen. So a lot of this, the pathway to be able to solve these problems are not mysterious, right? It takes courage of the policymakers to be able to understudy some of these things and bring in the policies that work to be able to help them.
This Saturday, Crystal Palace.
It's brilliant. Mateta, step over has got him away from Greaves. Oh, what a finish.
Chelsea.
Okay, Palmer, Jackson, 1-0. Made for Chelsea, and Jackson squares it.
Crystal Palace versus Chelsea. Live on Sporty TV.
Fortibet sponsors coverage of the English Premier League.
All right, welcome back. It's still Good Morning Nigeria live on the network service of the NTA, and our conversation is still on developments in the health sector. Our guests are still very much with us, and I'd like us to get to Maiduguri now, where Professor Audu joins us as President Nigerian Medical Association. Prof, we've talked so much about 2024. 2024 is gone. 2025 is here, and if you want to look at what President Bola Ahmed Tinubu presented to the National Assembly before the end of 2024, talking about the budget, the prospect for the health sector looks bright. I mean, in 2025, over 2 trillion naira. But speak to us really. What should we be doing differently in the health sector? We focus on maternal and child health. I ask that because despite all the efforts, the past years, maternal and child death is still on the increase. I mean, we celebrated World AIDS Day in December 2024, and the figures are alarming as to mother-to-child transmission of HIV and AIDS. I mean, you want to talk about so many issues, around mothers and their babies. What can we be doing, or what should we be doing in 2025, just so that we can bring down the figures as regards maternal and child death?
Thank you very much. First, let me correct that figure about the rural population of doctors per patient. It's actually 1 doctor per 30,000 rather than 300,000. So pardon me. So please note that correction. Now, I think the 2025 budget of 2.48 trillion naira is a remarkable improvement in terms of it's actually double what we had last year, even though in terms of percentage of the national budget, it's about 5.18%. I think it's not about much what we need to do differently than how prudent we need to be and how well focused we should be on our targets in terms of implementing the existing policies. I think we have robust, well-focused policies in place that, if pursued to logical conclusions, we should have outcomes that would improve our national health population indices. The sector-wide approach to coordinating the issues of health in this country is innovative, and it allows both national and subnational level players to put innovations, talents, and resources together to focus on the key deliverable outcomes that are measurable in the health sector. So if you look at the health workforce retention, that policy addresses the key components of the mitigating factors that result in our loss of health workforce manpower. If you look at the policy on standardization of healthcare facilities, each healthcare facility is supposed to be certified as a primary, a secondary, or a tertiary healthcare facility, which means it must fulfill basic standards of the components of the health manpower, the health infrastructure, diagnostic requirements, as well as the kind of treatment and the facilities for that treatment. It must offer on the minimum level. But so far, the implementation of that certification has not started. So we need to make sure such certification is put in place. We've talked about the one conversation, one budgeting, one monitoring, and so on and so forth, which are very good policies. But we have to understand that to deliver health care, you need the personnel. And it is this personnel that would ensure that those standards are maintained. In order for them to be able to do that, I think it is very important that moving forward from 2025, we are also able to provide a minimum benchmark for the welfare of those healthcare providers who provide this care in terms of minimum benchmark for remuneration, minimum benchmark for the standard of their own welfare, and for the standard of their workplace environment. Then and only then can we expect those improvements in our healthcare indices.
Professor Aldo, thank you. We'll quickly take another question from Bayelsa before we come back to the studio. Professor Brisbane, I'm just wondering because malaria is still one of the top, killers in our country today, and of course Bayelsa has a high stake in that. Recently, you took delivery of the Oxford R21 malaria vaccine, and you were also a pilot state. Can you talk to us? So far, what's the update on that?
Yeah, thank you. Oh, network. Hello? Hello? Hello?
We can hear you, Professor Brisbane.
Okay, thank you so much. For us as a state, we are very grateful to be part of the two pilot states in Nigeria alongside the Kebbi state. And what we did was to use that opportunity to once more deepen our immunization uptake. And we have been monitoring it between when we onboarded and commenced that process till now. We've gotten about 8,700 children that have taken that immunization. And with our partners, it's been very, very great. So it's a process that we've started. We are outside just doing that. It's also give us the opportunity to engage communities, engage our traditional rulers, engage our community opinion leaders to see that immunization is taken by children, emphasizing to them that, look, when you get children immunized, you are not just helping them in health, but also it has a ripple effect in education, because when a child is immunized, the number of days the child is going to be out of school will reduce, and therefore performances will improve. So it is that multi-sectoral approach that we used in launching it, and so far so good. It's very good. The uptake is fantastic. The conspiracy theorems around vaccines and immunization products has reduced reasonably, but it's something that we are going to do more, even as we start the new year, to see that we have that type of thing, the uptake get better and better.
Professor Brisibe, thank you. Let's get back here in the studio. Dr. Anas, I'm sure you want to respond to the maternal and child health issue. But, I'd like to add to that, we're talking about 2025 now and, how we can get things right and make things better. You've spoken so much about 2 primary health care centers in each ward and all of that. But some people say, besides just making the infrastructure available, there could be access, but affordability will be another problem. What would the government be doing, just so that as they can access healthcare, they can also afford it? Because the National Health Insurance Authority, we're talking about the Act and all of that, those who are even enrolled in the NHIA have a problem of, accessing, getting the requirements, the basic requirements in the health sector, because, the NHIA is not so functional, to the point where it can guarantee quality healthcare to the average Nigerian who is even enrolled on it, not talk about those who are not. Then, for those who are not a part of this, the cost of drugs at the moment, the cost of, a lot of things because of the present economic realities. Is the government thinking about how to make healthcare really, really affordable, to the poorest of the poor in Nigeria?
So thank you so much. And I think that is what the government of His Excellency President Bola Ahmed Tinubu stands for. Making healthcare services, quality healthcare service, accessible to all Nigerians. Issue of affordability should not be a barrier. And this is what we've all been saying. The new National Health Insurance Act makes it mandatory for every Nigerian to have access and to be insured. So what we need to do, we need to create more awareness. A lot of Nigerians are not even aware that those services are there, that they should access at their primary health care facilities. There is, we have said over and over, the Vulnerable Group Fund, which has also enhanced and expanded the access to the insurance scheme to provide the physical, the financial protection, and also provide a safety net for vulnerable people. So we need to do a lot of awareness creation, and also the state government also should align with these priorities and also bring in additional funding to support the federal government funding for it. So this is all we have been saying, and we have been advocating for it. And then when you look at the whole issue, of accessibility, it's not just the accessibility and affordability. There is also acceptability and the awareness of the services that are there. We're dealing with people that have their cultural norms, that have their behaviors, and that takes us to the issue of the maternal health. Sometimes the services are there, but they are not accepting it. They don't trust, they don't have confidence in it. So what we're trying to do is to build a renewed confidence and trust in the healthcare systems that we have, that the services are truly there. For a long time, they've not been having the services. That we are currently revamping our primary healthcare facility. We are revitalizing. We are making it functional. We are building capacities of our healthcare workers. Not only skilled capacities, but also attitudes of healthcare workers.
Absolutely.
Because I've just had engagement with a group of religious leaders and community institutions. And what came up on top were attitudes of healthcare providers. That's why women and children are not accessing services. So it's a collective responsibilities, and it's multidimensional, multi-sectoral. It's not just one health sector alone that can deal with the issues. So we need to learn to work together. And this is a major challenge that I have learned throughout my career of work in Nigeria. Every sector works alone. Every sector works in silos. There is no way you can deliver healthcare services without working together. Sometimes the problem in the facility is just water supply. And then the community will not access those services, even if they are free. Sometimes it's lack of security. The facility is not fenced. And they are afraid. And because of the insecurity that has escalated, which is much better now under this administration. But those are challenges. The facility has to be fenced. It has to be provide privacy. It has to provide confidentiality for people to be comfortable to access services in those facilities. So usually you will find affordability is not only the major issue. There are several other factors that we must address collectively across beyond the health sector.
Dr. Anas, thank you. We have less than 6 minutes to share. We have to share, equitably, so that everybody will have a share. So let me go again to Professor Aldu. Professor Aldu, again, altitude, confidence in the system. Dr. Anas has spoken about it and all that. And it's also visible, among the members of the NME. Recently, medical negligence, is beginning to spike and eroding public confidence in our medical institutions and all that. This is 2025. What are you telling us? What are you saying to Nigerians about, medical negligence?
Well, what I'll say to Nigerians is that medical doctors, and indeed all healthcare providers in Nigeria, will ensure that we keep putting in the best of our ability in the existing circumstance to ensure that we deliver quality, patient-centered healthcare to Nigerians. We have challenges, of course. There are medical negligences that do occur. There are medical errors that do occur. And the Medical and Dental Council is really making great efforts to ensure that any case of medical negligence or error is addressed, and it's also making a lot of efforts to ensure that these are minimized to the barest minimum. However, operating in the context of the environment where most doctors and other healthcare professionals have a lot of burnout needs to be addressed side by side in order to significantly reduce these errors.
All right, thank you very much, Professor Audu. Professor Brisibe, I'm sure you're still with us and your connection is clear enough. As we round up the conversation, tell us, what should Bayelsans be looking forward to in the health sector in 2025? And what do you expect from Bayelsa people? Dr. Anas was trying to talk about cultural beliefs and all of that affecting how people access, these health initiatives or facilities or whatever it is that is available in the health sector. Speak to the people also, besides telling us what you want to do in 2025 and how you expect Bayelsans to accept these policies.
Yeah, for us as a ministry, and I think even at the subnational levels, what we should do differently in 2025 is that we must have strategic investment in infrastructure, both at the primary care level, at the secondary care level, and try and connect all these to one whole, so where you have strengthened referral systems from primary to secondary to tertiary care, using some geo mapping. And also, what Bayelsans will expect is that at this point, the emergency medical system has to be re-energized, strengthened.
Professor Brisby, honestly, I wanted you to speak to that. I wanted to ask if Nigerians, if there's a toll Nigerians free number that Nigerians can now dial when they have health emergencies and all that, because that's what is obtained in other developed countries. And I know you are the co-chair of committee, implementing our emergency medical treatment and services. If we are not on, let's come to Aja. Can you speak to us about that as well? Because it's a critical part of the health care provision.
Yes, thank you so much. And I'm glad to mention that this was part of the missing link we realized in the health sector, about 2 years ago. And we started the national emergency systems, ambulance systems in Nigeria. So we started piloting it at the national level in Abuja and some few states, because a lot of it has also to be done at the subnational level in partnership with private sector. There was a number, I think, dedicated as 122 that you can call their ambulance. Yes. So it's aimed to bridge that gap, because we realize a lot of deaths happen, you know, we can save lives because there is no emergency care. So the private sector is part of it to handle the ambulance system and also quickly transfer to identified hospitals where services will be received without payment at the first contact.
So
you should deliver that service immediately. So this is being piloted, and states are also being encouraged to align with that emergency ambulance system. Some few states are already doing it, I think, like Lagos State. And then part of it also up to the rural areas, because we also realize that maternal death, which is still of major concern in Nigeria, because we contribute one of the largest burden globally. Maternal death happens mostly because of lack of emergency care. At the point of critical needs, the women do not have access to services.
Can you, as we round off?
So that critical need, when the woman can be picked by an ambulance, even if it doesn't have to be a sophisticated ambulance, an ambulance that would immediately at the point when they are called upon, provide services at the point and immediately transfer. You know, transfer. If it is blood transfusion, you can start transfusing, set IV lines, and then immediately transfer to the next facilities where services will be provided. So this is still work in progress, and it's also a major priority of this administration. And the Minister of Health has already established a committee that
Please, can you repeat the total number again? You know, at least for the states that are practicing.
It's 122. It's 122.
All right. We are out of time. Just so before we conclude the conversation, what's your final words to Nigerians? What should they expect in the health sector now that the president is presenting 2.48 trillion, you know, for the health sector? What should we see?
First of all, we appreciate the president for the allocation of the resources for health. It has demonstrated his commitment. Last year and today is much better than what we've had last year. So I want to urge Nigerians and also to encourage them to have trust, you know, and confidence in the government. A collective effort. It's a collective effort not only by the government, by each and every individual. We have a responsibility. Your health care, it's your responsibility. So you have to have trust, you have to access the services, you have to change our behavior in health-seeking behavior. And most importantly, I must mention that we must adopt healthy lifestyle.
Thank you so much.
Dr. Salma Ibrahim Anas, Special Advisor to the President on Health. Thank you. Thank you very much for the points you've raised, especially on the emergency services. Let's also appreciate Professor Bala Mohammed Aldu, President, Nigerian Medical Association, NMA, Vice Chancellor, Federal University of Health Services, Azarin Bolchi. You joined us from our Maiduguri studio. Thank you. Professor Seifa Brisby, Commissioner for Health, Bayelsa State, Co-Chairman, National Emergency Medical Treatment Committee for the National Emergency Medical Services and Ambulance System in Nigeria. Thank you very much for all your robust contribution, and we wish Nigerians and, of course, all our health managers the best of luck in the new year. Thank you, ma'am. All right.
So that's Good Morning Nigeria this Friday. Many thanks for watching. Enjoy the rest of your day and the weekend.
And you are?
Claire Adelabu Abdulrazak.
I am Claire Adelabu Abdulrazak. Thank you, and do enjoy your weekend.
I thought you would say Amien Region.
Okay, Amien Region.